Our hearing health is important. Hearing can affect our personal relationships, quality of life, and even our ability to go about a normal day. Joining me now to tell us how we can be proactive and take control of our hearing health is audiologist Dr. Carol Whitcomb Powell with Hearing Associates, a Hearing Life company. Thanks for being here, Dr. Powell.
Thanks for inviting me.
Well, it's always great to have you here. And in doing that research on your website, it was talking about hearing health. And to me, that sounded like a very positive term versus difficulty, challenge, or something like that. So tell us kind of what that hearing health means to you.
Well, it's kind of the buzzword at the moment. The baby boomers have finally gotten older. And so a lot of longitudinal studies are coming in, and we have a lot of information on hearing health. We know just by age alone, by the time you reach your 70s, 1 in 3 people will have hearing loss. By the time you reach your 80s, every other person will have significant treatable hearing loss. And from a very large study through the National Council on Aging, we know that hearing loss treated, people that treat the hearing loss, which would be surgery, medications, or hearing aids, have better quality of life with their family members, with their friends. They have less fear. They have less pain, less anxiety, better confidence. They're more social. And all these things add up to a healthier senior. In addition to that, and we're seeing a lot of this in the literature, and some of the viewers may have seen some information on this, there is a relationship between cognitive decline and hearing loss. Cognitive decline is a fancy word for dementia. Alzheimer's are all categorized in this study under one term. And it doesn't mean by any means, Jeff, that if you have hearing loss, you're going to have dementia. We know that everyone as they get older has a degree of cognitive decline, but there's a more significant relationship, a greater degree of decline if you have hearing loss. And the greater the hearing loss, the greater the cognitive decline.
Is this related to just lack of socialization and communication, or just being isolated, or is there other factors?
Great question. They're doing that research now. They don't really know. There's some that suggest it is. I don't want to go to that restaurant. I don't want to go to that party. I don't want to go to church. So I close down and I'm less social. And we know that socialization and exercise are huge to keep the senior healthy. The other thought is the brain's working differently. When the hearing impaired person is trying to answer a question, they're trying to figure out, did you say hat or cat or fat or sat? And so their brain very quickly is trying to figure out what was that word. So their brain is working differently than the person with normal hearing. So there's some thoughts that maybe it's the brain's working harder in one area, ignoring another area. We don't know. But right now, the suggested treatment is you need to get your hearing aids and you need to wear them. It's not good enough to own them. You need to put them on in the morning and you need to wear them 12, 14 hours a day.
We've addressed very well, actually, the socialization and communication aspect. But what about safety? I mean, just really getting around and not harming themselves or inadvertently someone else.
Well, as you know, with the work you do, many seniors want to stay home. They want to continue to be very independent. And if the hearing impairment can make that very difficult, you need to know, is someone outside your home for those type of safety? Can you hear the smoke alarm? Would the smoke alarm awaken you if you didn't have your hearing aids on and you were in a deep sleep? But even beyond that, the independent senior's making all their financial decisions. They're answering medical questions. They're taking down orders from the physicians. They have to hear all that correctly or they can't take care of themselves well.
Great advice. Well, and speaking of advice, what would you say to someone who maybe thinks that they do have some type of situation that they need to have checked out?
Hearing loss? Well, deafness is easy to determine. You don't hear. But hearing loss, many people can be in denial over that because if you're hearing impaired, you don't hear what's being said, so you don't know you've missed the message. Let me give a better example. If you're visually impaired, you can't read the phone book any longer, you trip over the ottoman, you have trouble seeing the signs. But if you're hearing impaired, you might not know that the neighbor said, How you doing, Mike? Mike just keeps on walking. So it's often family members and friends that inform the hearing impaired person, you're not hearing well.
And how do you advise them to have that conversation? You mentioned denial, and with that usually goes some type of, they don't want to hear it, they don't want to believe it. So how would a family member have that conversation with the person that they think needs to look into this?
Well, all family dynamics are different. So I'll start off with saying it may need to be delicate, or you may just need to look your dad or your mom in the face and say, you're not hearing. Often it does need to be handled delicately, like any type of medical condition. And often examples, because since they didn't hear it, they don't really often believe they missed it. But examples, the TV's very loud, or we're out for a restaurant and you didn't understand the waitress. Or you notice you're hearing, but you're not understanding me. I said 5, you thought I said 9. Those are symptoms. Those are all symptoms of hearing loss. That's one good. There are also some very nice hearing assessment tools online, if your senior is computer savvy, that actually give a very good assessment of, are you hearing okay?
That's great.
So there are tools that you can use also.
Well, you mentioned, several different options as far as treatment. Technology is changing all the time. I remember the huge hearing aid my grandfather had, and I know that's not the case. Tell us about what's the latest technology and advancements in treatment.
Well, boy, I've been at this a long time too. I might have put that big hearing aid on your grandfather. Hearing aids have really improved. The digital age has been just overwhelming in the changes we've made in hearing aids. Miniaturization has also been our friend too. But to answer your question, what's probably the most exciting thing has been the advent of the Bluetooth chipped hearing aids. This allows the hearing impaired now to have accessories beyond the hearing aid. So if you're wearing your hearing aids, but you're still struggling with the television, there are now accessories that can help you hear Bluetooth streamed through your hearing aids using the prescription of the hearing aids that makes television very clear, makes the cell phone clear, your landline clear. And that has been really fun to see people go, wow, this is better.
Great. Well, that's great news, and we could talk about this all day long, but I'm sorry, we're going to have to wrap it up. Thank you for being here. In the last 30 seconds, is there something that you think is very, very important someone should know if they're
I think there are two
this?
things. I think, first of all, people should have a baseline hearing test at 50. If you haven't had a baseline, you need to get a baseline. In addition to that, if you're going for a hearing test or for hearing aids, take a companion, take a loved one, take a friend, because they often can see your hearing loss through different eyes.
Great advice. Thank you very much.